Hi, I am Dr. Bhavani Rao. Today we will see why the medical treatment costs has been escalated tremendously. The cost of hospital admission and treatment, the medicines has gone up tremendously. Even upper middle class people also finding it difficult to get treatment without an insurance. The poor people are becoming more poor, and the middle class people, they have to sell their assets or they have to take loans, or poor people, they have to sell their cattle or belongings for getting the medical treatment. Why it happened so? You won't believe, 3 decades ago the patient doctor's relationship was so serene and peaceful. I will give you one profound example. 3 decades ago, there was a practice in Godavari districts of Andhra Pradesh. The patients used to go to the doctor, and for OP cases, the doctor did not charge anything, not even a paisa. Then how did the doctor get his revenue? The doctors used to perform Satyanarayanamurti Vratam, a puja, and he used to invite all his patients to that Vratam, and people used to show their gratitude by offering huge amount of money or their natural produce. Both the doctors as well as patients were happy. For example, there is a case of appendicitis. Previously, if these doctors say this is acute appendicitis, the patient is taken to theatre, did operation, and patient went on well. So the cost of the appendicitis used to be 2000 rupees, 800 rupees for the surgeon, 400 rupees for the anesthesiologist, 400 rupees for the medicines, and 400 rupees for the nursing home. Then also there used to be small mishaps or mistakes, but patients used to take those occurrences in their stride. Then in 1986, Consumer Protection Act was introduced, and doctors were also brought under its purview. What is Consumer Protection Act? It safeguards and encourages consumers to speak against inefficiency and flaws in goods and services. And the doctor services also were brought under its purview. Why the treatment costs escalated after introduction of Consumer Protection Act? I am Dr. Bhavani Rao. I am practicing surgery for the last 3 decades. I worked in government service, voluntary organizations, corporate hospitals, Christian mission hospitals, Andhra Pradesh, Telangana, Tamil Nadu, and Kerala. With this experience, I am trying to analyze the reasons of high treatment costs after introduction of Consumer Protection Act. The Consumer Protection Act was made to safeguard the interests of the patients. For example, if a doctor is negligent or unethical in treating the patient has the right to take the doctor to the court of law. Courts of law usually decide whether the doctor is negligent or unethical. This is a good intention. So how it was evolved? How the Consumer Protection Act evolved over the decades? When it was introduced, some senior doctors advised against implementing it. They thought that the cost of treatment will phenomenally increase. This advice was given 3 decades ago. As they predicted, the treatment costs escalated phenomenally. Even they did not expect to this extent. If poor people go to the hospital, they have to pay hefty fee. Sometimes the middle class people, they become poor, and the poor people are very difficult to get treatment. The Arogyasri was implemented to save such situations. That is a different story. Initially, after introduction of Consumer Protection Act, it did good service in the sense, if a doctor forgets a mop or a surgical instrument inside the abdomen of the patient, the courts used to fine the doctors. Later, the Consumer Protection Act was applied even for some doubtful cases. Doubtful in the sense, when the doctor is not at fault also, the courts used to be partial towards poor patients. In order to relieve at least some of the pain, the courts used to award compensation to the patients. And this practice has escalated. In some cases, the doctors were forced to pay 50 lakhs, even in a few cases 1 crore also. This is somewhat surprising. So if, for example, a bridge was constructed with taxpayers' money, and in the process of bridge collapse, if the people died, the compensation given by the government is about 5 lakhs or so. A patient suffering from a disease, if he dies either of the disease or, let us say, negligent act of the doctor, he was hugely fined. In the initial stages, doctors used to keep the incident secret. They were shy among themselves. They doesn't want to talk about the case with your peers or in the public, because their practice would have been affected. In a few cases, even if the doctor is not at fault, in order to avoid bad publicity, they used to pay the patients to hush up the case. The media used to be judgmental, and they used to exploit the situation. If a patient dies or if he gets complications, they used to highlight the issues. And if the courts award punishment to the doctors, they used to highlight. Terrifying the doctors has gone to such an extent that beating of the doctors, damaging the hospital property has become a norm. Even if doctor did not commit any negligence or insufficiency in service, that fact was not reported in media. At the time, there are no social media and there are no cell phones to capture what happened in the operation theatre or what happened in ICUs. The doctors has to pay for a few bad reporters. Gradually, the local leaders and common people came to know that even if the doctor is not at fault and the complication or death occurred due to natural cause of the disease, they used to exploit the situation. They used either to avoid the fee or get some compensation. The doctors didn't have good option. They had to pay the reporters, the local politicians and local bad elements of the society. Luckily, over a period of time, the social media came and the doctors doesn't have to rely on the reporters or TV channels for presenting their facts. For complicated cases, they started taking video consent and they used to record what actually happened and they used to present their version. Earlier, the local goons in the guise of relatives entered the hospital, damaged the furniture, and several incidents of doctors manhandling also occurred. All these things were captured in CCTV and courts became active and started punishing these criminals. Nowadays, such incidents became less and less. Not all reporters or politicians or local leaders are like that. A few of them definitely blackmailed the nursing homes and doctors. The doctors has to pay the compensation out of their pocket. Where do they get the money? Ultimately, the doctors also evolved. They charged more to the patients even for normal surgery. A few doctors, unable to continue such practices, closed their nursing homes in small towns. Others became Sankardada MBBSs. In the sense, they used to befriend the reporters, the local politicians, local gundas, and they have to maintain good relationships with local police to continue their practice. And all this cost money, either in the form of gifts or bribes. I am not talking about all the politicians, reporters or policemen. I am talking about bad elements in the respective professions. I am not talking about all doctors also. Where does these Sankardada MBBS doctors get that money? They have to extract it from the patients only. That is one reason for escalating of the treatment cost. The doctors also started defensive practice. Even for simple cases like appendicitis or perforation, in order to convince the patients as well as in order to guard unnecessary litigation and Consumer Protection Act penalties, they used to order investigations. These investigations were expensive. Ultrasound, CT scan, MRI scan, they became normal. The cost of the treatment escalated. Even if the case is slightly risky, the doctors refused to do surgery or give treatment. They used to refer the case to higher centers. The corporate hospitals came into picture. The corporate hospitals provided very good expensive infrastructure. They have very good intensive care units and it used to be manned 24 hours by class 4 employees, the staff nurses, the duty doctors and on-call specialist doctors. And it cost money. The cost of this infrastructure sometimes goes into crores of rupees. And the corporate hospitals, they have to borrow the money from the banks. and they charge huge interests. And the corporate hospitals added their profits, and the bills previously used to be thousands of rupees now became lakhs of rupees. And all this money they had to get back from the patients to sustain their existence. They promoted unscrupulous registered medical practitioners and local leaders. If they simply bring the case to hospital, a certain amount of money was given to them, and the amount of money that is paid to these people is huge. Sometimes it is more than what the treating doctors get. This is another reason for escalating of costs. Now, even for the common treatment also, the patients has to shell out huge amount of money. Sometimes they have to sell their properties, they have to go for loans, etc. Common people started taking insurance for their medical ailments. As the trust eroded, the patients started suspecting the doctors. Sometimes the patient's suspicion is genuine. I will narrate one story in my life. One patient was diagnosed with acute appendicitis by a senior surgeon and went to Queen's NRI Hospital, Visakhapatnam. She is not satisfied, so she wants to get second opinion, and I have taken the history and examined. After that, I have seen the investigation that it was acute appendicitis and performed laparoscopic appendectomy. It was a routine case, and when I have seen her intestines through laparoscopy, there were no signs of any tuberculosis or any other disease except for acutely inflamed appendicitis. The removed appendicitis was submitted for histopathological examination, and the result also came as acute appendicitis. Post-operatively, she has slight discharge in the wound, but that was normal for most of the people. But the patient repeatedly exposed herself to variety of investigations, and she consulted different doctors. None of the doctors found fault with the operation, but she was not satisfied. She complained to the Medical Council of India, Andhra Pradesh branch, District Medical and Health Officer, and the Consumer Protection Act court. None of the people found fault with me or the surgical team after thorough verification. The AP Medical Council consists of about 10 doctors. They thoroughly examined me and the patient. Likewise, the KGH doctors and the Consumer Protection Act court. After the court decided that I am innocent, but I was kept wondering why she approached so many people. The reason is she suffered from intestinal tuberculosis a few years ago. That fact was hidden from the doctors. She is thinking that the present pain is because of intestinal tuberculosis, but not acute appendicitis. She thinks that the doctors are making wrong diagnosis and did wrong surgery out of mistake, and she wanted to make money of the situation. That is the reason. The sad thing about this is even the doctors refused to cooperate. When she approached a reputed gastroenterologist, he performed colonoscopy. He found only normal findings. That report would be useful for me as an evidence in court of law. but he did not share the investigation with me. During interrogation by KGH doctors, one of my senior surgeon, after inquiry was over, he made a phone call that he will write adversely, indicating that I had to offer him a bribe. But I did not budge because I did not do anything wrong. I will present another case of unethical exploitation of a political party with local gondas. Some time ago in Chodavaram, a case was brought to the hospital. The doctor had experience of 30 years. After examining the patient, the doctor told clearly that the baby was dead, but if the mother harbors the baby, it will give complications that will lead to mother's death, and there can be a possibility of bleeding also. They signed the consent, then the delivery was conducted. That baby was delivered, but there is excessive bleeding, what is known as postpartum hemorrhage. At that time, there were no facilities for blood transfusion. Immediately stabilizing the vital signs like heart rate, pulse and respiration, the patient was rushed to KGH. In KGH, the blood was transfused, patient stabilized and the mother survived. Then what is the issue, you may ask? The local political party, with the help of local people, it extracted money from the nursing home. Why and how? After 2 days, they came back and asked for the dead fetus for honorary burial. Actually, when the patient was referred to the KGH, there was no one to receive the dead baby. So the doctors handed over the dead fetus for safe disposal by the municipality employees. They came back after 1 week or so and they extracted huge amount of money. Sadly, the major share of the money was taken by the local political party and the patient was given a small share. Fed up with such incidents, the doctors closed the hospital and took a retirement. I can give similar examples in Kekotapadu and surrounding areas. I posted a few in my Facebook posts. You can go through. Now going back to Consumer Protection Act, is it doing its duty of protecting the patients? Take for example one case of cesarean section. Not all people are alike. Not all cases are alike. During cesarean section, after baby is delivered, sometimes there will be huge bleeding from the cut end of the baby bag, the uterus. In order to control the bleeding, the doctors sometimes give pressure mopping. That means mop is nothing but several folds of cloth stitched together to absorb fluid. They press against the bleeding vessel and try to control it. Sometimes it is bleeding from 2-3 different areas. Sometimes bleeding occurs throughout the wound at different areas. It is not possible to simultaneously control all the bleeding sites. So they pack the different sites and deal one by one. The soaked mop becomes very small and sometimes it will be hidden behind the crevices of the intestines or behind the uterus. After a strenuous surgery of 2 hours or so, the surgical team and the surgeon become exhausted. Intense focus on the surgery is slightly relaxed once the patient condition is dealt with. They have to look at the same time the vitals. The vitals of the patients also are dynamic. For example, if your friend asks you about your heart rate, you will tell that it is 72. The heart rate keeps on fluctuating. It is anywhere between 60 or 80. During surgery also, the vitals of the patients keep on changing. The doctor is constantly under tension. If the blood pressure falls down, the pulse rate increases, or respiratory rate becomes irregular. Under that tension over a period of 2 hours, he or she has to do the surgery, and retrieving the mops becomes low in the list of attention. Not only the doctor, the assisting nurse, the people around like anesthetist and scrub nurse, all of them forget about that mop. But actually, on the patient's point of view, that's a very gross mistake, because the patient suffers and the patient has to undergo another surgery. So what is the solution? Do the patient has to suffer because of inattention of the surgeon or surgical team? No. One person or this extra scrub nurse should be unattentive, and she has to be paid, and the treatment cost should be slightly raised. There is no doubt. How to reduce the cost of the treatment then? How to get back to the days of Satyanarayanamurthy Vratam, where there is immense trust between the doctor and patient, and the cost of the treatment was very low. The solution lies in the understanding of the problem. A surgical case that is performed under emergency is different from a court case decided in the court of law. In the court of law, the judge, defense lawyer and prosecuting lawyer have plenty of time. They can revise the book again and again. They can postpone the case several times, and after several times, interpreting a fixed law with fixed evidence, they decide on the case and award the judgment. The same case goes to the higher court. There, the same evidence is presented, the same law is applied, but a different judgment is given when they have plenty of time to decide. Surely, one of the lawyers in the lower court has to be punished for not correctly representing the case to the court. But we don't see such cases of law negligence. The consumer protection courts became unsympathetic to the doctors. While awarding the compensation, sometimes it went on from 50 lakhs to 1 crore. For example, a person dies in a road traffic accident who is perfectly healthy. He was awarded a compensation of about 5 to 10 lakhs. But a patient, unhealthy patient, after several attempts to save his life, dies in an operation theatre or ICU. The hospital is awarded 50 lakhs to 1 crore or so. Law is nothing but legalized common sense, whereas medical science is constantly evolving. The understanding of human anatomy, physiology, pathology, both at cellular and macroscopic level, is constantly changing. None of the drugs are completely safe. None of the suture materials are completely safe. Surprisingly, even if a drug reaction comes, the responsibility goes with the doctor, not with the manufacturers. Same is true about a drain or a mesh or any instrument that is implanted into the human body. It was the sole responsibility of the surgeon to decide. And the surgeons also cannot opt for their choice. True, a few doctors take commissions from the medical companies. That is bad, and such practice is not present in other professions. If bad material or drug is employed and the patient responds adversely, the doctor and the hospital will be held responsible. We will compare a surgeon with a judge. A surgeon in operation theatre has to perform the surgery on a dynamic patient where the vital signs keep on changing and the science that was developed till today. Human body is so complex, although we understood a lot of it and a lot has to be learned. A given practice, whether it is correct or not, will be decided after a few years. Take for example a judge. There is another difference between law and medicine. In law, a lawyer's primary aim is to win the case any means. That is detrimental to truth, and they deliberately hide a few facts, distort few facts likewise. Whereas in medicine, if the patient survives or becomes normal, the doctor gets more reputation, more money, and more patients. Another strange anomaly is the Constitution has given immense position for judges. He decides what is right and what is wrong. But a life-saving surgeon or doctor has not been given a similar position. Administrative officers like collector and tahsildars were also given magisterial powers. But in order to deal with unruly mobs or hospitals, a doctor is not given any magisterial powers. The central services, IMS, Indian Medical Services, was completely abolished, and the positions like Surgeon General in America doesn't exist in India. Is there any way out of this vicious circle? How to identify the bad doctors who bribe reporters, politicians, local gundas, police people? How to stop kickbacks to the registered medical practitioners? If all these evil practices are stopped and unnecessary investigations are avoided, surely the patient doesn't have to pay that much to the doctor or hospital. Then, when the costs become manageable, the smaller nursing homes in the towns and cities, they become viable and they start service. What is the way out? In order to understand what is going on in emergency surgery in tense moments, a judge sitting on court with plenty of time cannot clearly understand the situation. The responsibility of counting mobs and surgical instruments actually lies with the scrub nurse and the operating nurse. Even if they commit mistake, the compensation will be extracted from the surgeon, not from the nurses. Likewise, if a suture material or a medicine gives some adverse reaction or effect, the surgeon will be held responsible. Do you remember one doctor was arrested for 13 tubectomy deaths because the tablets that were distributed were contaminated with rat poison? If a surgeon believes in a particular stent, he is accused of favoring a certain company because it gives certain kickbacks. A few doctors certainly will do that, but who will be responsible for complications that are arising out of cheap implants? After so many years of training, studying, doctor has to perfectly apply his knowledge within tense situation of operation theatre. Even ordinary tasks like driving will result in accidents and death of so many healthy people. In operation theatre, there is very little scope for correcting their mistake. It's not like writing a code for a program. Program doesn't run properly. You can always recode and redo it again and again till it becomes normal. Even that also sometimes takes days and nights together. The correct people are the surgeons with similar experience. A rogue army official is prosecuted by a group of army officials. Likewise, a judge's appointment is done by a collegium of Supreme Court judges. If a mistake or error or unethical practice happened in a certain treatment, the senior doctors are likely to find the fault precisely. In the court of law, it is something like carpet bombing. Whether the doctor is at fault or not, he was punished. Surely there will be some bad doctors with unethical practices. If a trial system with senior doctors is appointed for dealing with cases of unethical practices, then the bad doctors will disappear or go down in the medical practice. Likewise, there won't be any unnecessary investigations and there is no need to send just ordinary cases to corporate hospitals or higher centers. These cases can be done in smaller town hospitals. The cost will go down and the trust between doctor and patient is established. I finished the topic by asking you the opening question: how does the Consumer Protection Act protects the patients? Medical services should not be equaled with other services, because before taking the patient to intensive care unit or operation theatre, the surgeon and the team always explains to the patients the possible complications and the possibility of death also. Even for simple appendicitis, it carries 0.5% risk. That means for every people of acute appendicectomy, there is possibility of one death, because science evolved so far only. And if you want to avoid that 1% also, the government should spend some money towards research to avoid such complications. After explaining all the complications and possibility of death only, the patient will be given written consent. That means the patient or the attendants has to sign the consent form. Once consent is there, then only the doctors operate. Sadly, this consent form is not valued in court of law, but the doctors and hospital will be punished greatly if the consent form is not there, saying that they forcefully did this surgery. All the documents in the court are valid and given weightage, but a consent form which explains all the complications and the possibility of death is not equally given importance while deciding the case. Who should take up the responsibility of abolishing the Consumer Protection Act? It's not the doctors, it should be the patients. The unscrupulous elements in the society, like the people who are getting benefited by expensive investigations, by expensive infrastructure of the hospital, and a few bad lawyers, they want the Consumer Protection Act to be continued. But the sufferers are the patients and the doctors. As long as they keep quiet, this practice will go on and on. Even in America also, it is the same situation, but the civil courts will decide there. Here, consumer protection courts deal with such cases. In England, there are good health facilities provided by the doctors, and the health budget goes to 20%. Whereas in India, the health budget is only 4%. Because of that, the corporate sector is flourishing. Not only there is mutual suspicion between the doctors and patients, the costs and suffering of the patients has increased. The health department of the country should be managed by doctors, just like in United States of America, where a surgeon general is the topmost health authority. Likewise, National Health Services of UK also managed by the doctors, and the decisions of the doctors are accepted by the government. In India, it's not like that. Even at district level also, the collector manages the health needs of the patients. The common people, they are not getting the required treatment at low cost at a place that is convenient to them. Should be involved in abolishing the Consumer Protection Act, so that the earlier good relationships between doctor and the patients will be re-established and the cost of the treatment goes down. And who should fight for removal of Consumer Protection Act for health services? Who is suffering? Doctors on superficial level, but actually the patients are suffering. Because of Consumer Protection Act, ultimately the patients suffered a lot and suffering a lot because of undue, very high hospital bills. Now all this amount has to be extracted from the patient. Ultimately the patient has to pay for corrupt politicians, corrupt local goons, a few corrupt policemen for the investigations, for the insurance of the patient, and for the insurance of the doctors. All these things are added to the patient's bill, and finally the treatment cost became escalated. And the common people should fight for the removal of Consumer Protection Act so that the bills will reduce. And I hope that the final peaceful trust between doctor and the patient, which used to be there in Godavari districts, comes back. The patient doesn't have to pay for routine outpatient consultations. Whatever the patients have, they can contribute on the day of puja. Thank you very much.